Can we have the next speaker? Dr. Ashis GHOSH is here. Yes, please. He'll be speaking on outcomes of repairing open globe injury combined with or without pupilloplasty.
So good morning, everybody.
Thank you.
Good morning, everybody. Today I am going to present the outcome of open globe injury repair combined with or without pupilloplasty. I am Dr. Ashis Ghosh from Shri Ram Netralaya, Pune. Open globe injury is a significant cause of permanent visual impairment and blindness worldwide. It is associated with
This Ashis, I know that. And this Ashis, I know his name.
It is associated with significant morbidity and loss of productivity. The cornea is the major refracting surface of the eye. Minor changes in its contour result in significant visual problems. Aim is to describe the characteristics and correlations of open globe injury with sharp or blunt objects and outcomes following the surgical open globe repair for maximum visual rehabilitation with pupil reconstruction. It is a retrospective study done in the tertiary eye care centers in Pune. 15 patients included in this patient. 2020 to 24, this time period we have done this case series, and age group is 4 to 40 years included. Open globe injuries, the following signs: corneal and scleral tear, iris prolapse, distorted pupil, hyphema, and traumatic cataract. PCR was included in this study. And patient is having no PL, absolute eye, retinal surgery patients are excluded from this study. So we have done all the tests and that posted for surgery. These are the corneal tear repair, scleral tear, and conjunctival tear done. And basic instrument used for pupilloplasty is MST forceps scissor and these sutures. The technique used single pass 4-throw pinhole pupilloplasty. So the procedure I will explain a little bit. This is a trauma of open globe injury, and in this surgery, first I have excised the iris uveal tissue, then corneal tear repair done. After that, I have seen that it is a distorted pupil with traumatic cataract. The picture is this, and then after 30 days, I just allow the heal the wound, and then the surgery is done for cataract surgery and implanted lens, foldable lens. And in the same sitting, the second sitting, I've done the pupilloplasty. Single pass 4-throw pupilloplasty is done with the propylene suture. This is another case. This is a 13 mm copper wire trauma. Is gone to the eyes and it is removed. This is a pre and post-op cases. This is a 5-year-old boy. Styles injury, iris prolapse. I have done pupilloplasty with corneal tear repair. This is another case. So results: the 3 patients underwent the second surgery after 3 to 4 weeks, and intraocular foreign body found in 1 patient, scleral patch graft done in 1 patient. The result is out of 15, 12 patients were male, around 80%, and age group 0 to 20 years age group was more. It is 10 out of 15 patients. The pencil, sharp tiles, stone, knife injuries, steel wear, and hard hand injury, fist injury is there. And the important findings, we have seen corneal tear, shallow AC, iris prolapse, distorted pupil, and hyphema. Out of 15, 10 patients pupilloplasty we have done. Around 67% patients undergone pupilloplasty. Vision improved after 1 month or after 2 months. Vision improved more than 612. It is 67% patients improved more than 612. The zone 1, 73% patients the trauma is included in the zone 1, and size of the wound maximum was 3 to 6 mm. The discussion: the corneal scar following perforating corneal injury causes the significant visual reduction. Mainly because the direct obscuration of the rays. Pupilloplasty will give a good visual outcome if corneal scar is not there in the center. If lens injury is there, cataract surgery can be done after the second sitting. And pinhole pupilloplasty is one of the sophisticated procedure we should do in post-trauma cases to get the best good visual outcome with less astigmatism and the indications are the functional and optical indications for iris defect,
Please sum
iatrogenic,
up. Please sum up. Time is up.
and conclusions. Should I continue, sir? Yes. The conclusion is that corneovascular tear repair done in open glove injury cases is insufficient. Alone is insufficient. Adequate time must be given to corneovascular wound to heal. And cataract extraction, IOL implantation, pupilloplasty will give the best visual, best possible outcome in cases where traumatic cataract occurs with pupil distortion. Pupilloplasty should be considered in post-trauma cases if pupil is distorted. Thank you, sir. Thank you.
Thank you very much.
So majority of, I'm sorry. So majority of your patient, you said that only single pass, fourth row.
Yeah.
So is it possible for traumatic pupillary, irregular pupils? So all the pupil cannot be the same way.
Yeah.
You cannot repair all pupil with
And
the
not
same
possible,
way.
ma'am.
It's not possible in
Yeah.
trauma.
Yeah.
So, and what was the difference when you did single pass, double pass? You said that you have not done double pass. So ultimately, you're not studying that part. Visual outcome also will affect, and corneal astigmatism will
Yes.
also affect higher order aberration will also
Yes, ma'am.
affect. for
Actually, just we gone through these cases, so I thought I have seen many presentations that pupilloplasty was not there in trauma
Yes.
cases. Sometimes we are ignoring patient is having some problem, so we thought we can.
that. Yes,
Present.
so aim was to prevent them myopia. That was wonderful thing, but
Yeah.
pupil always in trauma, it will be a varieties of pupil.
Yes,
You
yes.
cannot have one.
Wherever possible we can do, so that's why.